Advocacy. PNA's MOA signing with DOLPIA. The Philippine Nurses Association, as part of its mandate, seeks to protect and uphold the general welfare of Filipino nurses, both locally and internationally, has just recently signed a MOA with PIA-DOL on November 7, 2017. An integral part of this MOA is PNA's role as an official DOL partner in labor inspection, tripartite negotiations, policy-making, and research endeavors to ascertain that labor laws are observed and developed to better serve the welfare of nurse employees, especially in the private sector. Thus, given the massive openings abroad, specifically in Taiwan and Germany, and in other parts of the world, PNA offers nurses going abroad the PIAS, Pre-Employment Orientation Seminar, and the DOS, Pre-Deployment Orientation Seminar, to adequately equip them to be able to ascertain their safety and overall well-being. Furthermore, registering as an all-nurses workers organization to better serve nurses and file complaints against those who subject nurses to work conditions and other situations that in any way may compromise their dignity both as human beings and as professionals. Anastasia Giron Tupas took the opportunity of the Pension Auto Act at the age of 24 and left the Philippines to study in the United States using her resources. She traveled to the United States in 1914 to complete postgraduate courses in hospital work at the New England Hospital for Women and Children, in Boston, Massachusetts, and the School of Public Health and Social Work in Philadelphia, Pennsylvania. Mr. Teodoro Arianco provided her with a scholarship for her course at the School of Social Work and Public Health. During her 20s, while she was in the United States, she visited various hospitals and health centers and was then guided by Miss Jane A. Delano, who was then director of the nursing service of the American Red Cross. Upon Anastasia's return to the Philippines in 1917, she was anointed as chief nurse and superintendent of the Philippine General Hospital. She was compensated with 3,000 pesos a year, which made her the highest paid nursing leader during her time. In 1919, Anastasia Giron served as secretary-treasurer of the Board of Examiners for Nursing. Under the supervision of Ms. Tupas, the UP School of Public Health Nursing then became the premier school of nursing and produced the best graduates in public health nursing. The Philippine Association of Board of Examiners accorded her in 1951 an outstanding award for her exemplary achievements. The year after, she published a book which she authored, On the History of Nursing in the Philippines, the most authoritative book on the rise of nursing in the Philippines. She also received the Presidential Medal of Merit Award on July 3, 1959, through the initiative of the Civic Assembly of Women of the Philippines, COP. President Garcia conferred a Presidential Medal of Merit to COP awardee, Anastasia Giron Tupas, for accomplishments in nursing education. Being the intrepid educator that she was, at the age of 70, Anastasia Giron Tupas conducted a feasibility study on the projected College of Nursing in the Philippine Women's University, poanursing.com, ND. In June of 1960, the Philippine Women's University College of Nursing opened and began accepting students. She later served as the dean and then, upon retirement in 1963, served as the Dean Emeritus of the College of Nursing of the Philippine Women's University. Dr. Mary Luong, a former dean of the College of Nursing, Cebu Normal University and immediate past national chairperson of the Philippine Nursing Association. She is an active member of the Beta Nu Delta Nursing Society.
The Philippine Nurses Association laments the failure of nursing law. The Philippine Nurses Association said some nurses in the country still receive $2,000 as monthly income, a meager amount that should have been upgraded if former President Benigno Aquino III signed the bill seeking this wage hike of entry-level nurses. Aquino rejected House Bill No. 6411 and Senate Bill No. 2720 supposed to enact a comprehensive nursing law.
The Philippine Nurses Association was awarded the Most Outstanding Accredited Professional Organization by the Professional Regulation Commission in 2003, 2014, 2016, and 2020. The initial accusations were made by students, who contended that the president of the Philippine Nurses Association had provided the exams to students who took his coaching classes. The scandal, officials said, could greatly damage the status of Filipino nurses abroad. To promote the holistic welfare of nurses and to prepare them to be globally competitive, we personally think they should increase the nurses' salary to prevent inadequate staffing or nursing shortage. Inadequate staffing can cause mandatory overtime and it causes the nurse to work for a long period of time. They should also offer altered schedules to accommodate the personal and professional needs of nurses because achieving and maintaining a personal and professional life balance is often difficult for nurses. The Philippine Nurses Association could also grant student nurses who are in need of financial assistance a scholarship. The nursing profession needs nurses with a higher level of education and not merely more nurses to enhance patient outcomes. To improve quality patient care, the nursing discipline needs to be advanced through theory development and knowledge generation, thus graduate nurses. By granting scholarships, they can help produce more globally competitive Filipino nurses. In these very difficult times, our constituent representatives are in the front lines in the fight against COVID-19. They've been fighting the virus in order for the world to survive amidst this pandemic. The ways of how they can contribute is to promote a positive practice environment for nurses. Contribute to nation building through institutionalized social responsibility initiatives. Provide effective trainings and programs for nurses to have an efficient way in easing the virus.